வாழ்ந்து காட்டுவோம் நாம் வாழ்ந்து காட்டுவோம் வாழ்க்கை என்னும் வரத்தை நாம் வாழ்ந்து காட்டுவோம் இந்த AIDS என்கின்ற நோயை ஒழிப்போம் என்று தினம் சொல்வோம் தடுக்கும் வழிமுறைகள் அறிவோம் இனிக்கும் தலைமுறைகள் செய்வோம் வாழ்ந்து காட்டுவோம் நாம் வாழ்ந்து காட்டுவோம் நாம் வாழ்ந்து காட்டுவோம்.
Vanakkam. As Consul General, I'm proud to represent the United States as we commemorate World AIDS Day here in Chennai. The U.S. government is committed to zero discrimination in the workplace, to include ensuring fair treatment and equal opportunity employment of people living with HIV/AIDS. Our workplace policy clearly states U.S. mission employees with HIV infection or AIDS shall be given the same rights, benefits, opportunities as employees with other serious illnesses. Further, to prevent work disruption and rejection by co-workers of an employee with AIDS or HIV infection, the U.S. mission shall protect the confidentiality of employees' medical information and shall undertake education of all employees. We're pleased with the partnership between the Centers for Disease Control and TANZACS, as well as other organizations in South India, and are now celebrating a highly successful 10-year collaboration to prevent, combat, and manage HIV/AIDS. We also recognize the U.S. Agency for International Development for their efforts on this front. Let us work together to reach zero infections, zero AIDS deaths, and zero discrimination. Thank you.
Four major strategies to move towards zero in the days to come. First is reach out to all those people who are at risk. Increase the number of people reached for prevention who are vulnerable and at risk for contracting HIV. Number two, increase the availability of services to those people, whether it is STD services or products like condom being made available. Number three, increase the accessibility to integrated counseling and testing services for these people so that they know their status. Number four, increasing the accessibility to antiretroviral therapy services and making it widely known to people that this is available even if you test positive. The mantra is, you don't lose the tempo, keep up the tempo, involve the community and provide better services for prevention.
NACO has started the National AIT program in April 2004. Now the NACO has scaled up the AIT services. AIT is available universally and all patients are going to AIT center can avail AIT services. If you take AIT regularly, the mortality is reduced, that is the death rate can be reduced, the morbidity can be reduced, the opportunistic infection will be reduced, the patients can go to work, they can earn so by the time so that the standard of living can be raised. Now the problem is the patients come to the health services in stage 3 or 4 in the advanced stages. Because of that the mortality death is more. If the patients come to the early stage, if you start the AIT in the early stage, then we can go for a zero death related AIT.
But one of the most important initiatives which we have taken relates to AIDS. The prevention, cure and the elimination of discrimination, especially at the workplace. You would have seen how even in India today, people still have this antipathy and they feel that it is something which people with HIV/AIDS should be totally ostracized. And I think we are trying our level best as part of a major industries association working closely now with the US agency, USAID, called, the project is called Connect, to say that one can live with those people. They are also members of society and they need care and concern, and how we all should put our heads together, our shoulders together to see that such discrimination is eliminated.
வாழ்ந்து காட்டுவோம் நாம், வாழ்ந்து காட்டுவோம். வாழ்க்கை என்னும் வரத்தை